Hi, my name is Haley Flanagan, and today I'll be talking about why mental health should be talked about in schools. Mental health issues have become increasingly prominent in recent years, affecting a multitude of individuals worldwide. Despite this, there is an incredibly negative stigma surrounding mental health and getting help. In order to change the way mental health is perceived and handled, we need to make it an educational requirement in schools by requiring classes focused explicitly on mental health. Today, I will be discussing why educating today's youth on mental health issues is of utter importance, which will be enforced by the elaboration of the following 3 points. 1. Why creating an open environment to discuss mental wellness in schools will help decrease the stigma surrounding it. 2. How mental health disorders start affecting children at early ages and for the most part go unrecognized and therefore untreated. And 3. How suicide is the second leading cause of death for individuals from the ages of 10 years old to 34 years old. Stigma is defined in the dictionary as a mark of disgrace associated with a particular circumstance, quality, or person. Ideas that individuals with mental health disorders are dangerous, unpredictable, incompetent, and are to blame for their disorder are prevalent as social and institutional stigmas. The effect that these ideas have on individuals are very real, with over 50% of people with mental illness who don't receive proper help for their disorders by virtue of being treated differently, according to the American Psychiatric Association. Along with not seeking treatment for these illnesses, stigma can also lead to the worsening of symptoms associated with the individual's disorder, reduced hope, lower self-esteem, and a lower likelihood of sticking with treatments for the people who are receiving help. The stigma surrounding mental illness will always lead to harm at the end of the day. Normalizing the fact that many people struggle with mental health and that it is good to receive treatment for these struggles is the only way to get rid of the stigma, and educating today's youth is the first step in this process. Creating an open environment to discuss mental wellness is extremely important. Mental health disorders start affecting children at early ages, but for the most part, they go unrecognized and therefore untreated. This affects the child's ability to learn, grow, and flourish in both school and life. According to the CDC, approximately 4.4 million children between the ages of 3 to 17 have been diagnosed with anxiety, and approximately 1.9 million children between the same ages have been diagnosed with depression. When ADHD is also considered, these numbers increase to a staggering 6.1 million children between the ages of 2 to 17. These shocking statistics reinforce the fact that teaching our youth that mental health is a priority and is nothing to be ashamed of is absolutely critical if we want to see change. Showing children how to communicate their feelings, navigate their thoughts, understand when to ask for help, and help others will only fuel progress. According to the National Institute of Mental Health, suicide is the second leading cause of death among individuals from the ages of 10 to 34 years old and is the 10th leading cause of death in the U.S. overall, claiming the lives of over 47,500 people in the year of 2019 alone. In fact, more children and teenagers who are in school are dying as a result of suicide than those of which who die from cancer, heart disease, AIDS, birth defects, stroke, pneumonia, chronic lung disease, and influenza combined. As these statistics and facts obviously portray, suicide is a tremendously prevalent issue for today's youth as well as today's adults. Educating children in schools about the risk factors, warning signs, and resources for help will only help lower the amount of individuals taken by suicide and increase awareness. Suicide may seem like a scary or bad thing for children to be learning about in schools, but by discussing it in a learning environment with an adult figure who is well versed on the subject, it won't seem scary or bad. I can relate to this bit personally as someone who does deal with severe clinical depression. When I was younger and I was having suicidal ideations, I was scared and ashamed of them. Rather than telling someone and getting the help I needed, I actually ended up attempting suicide. Even after that, I was too ashamed to get help. I stayed suffering in silence until 6 years later when a coach forced me to go to therapy because my ideations were getting to that point yet again. I'm very grateful that I'm still here and that none of my attempts had worked, but to think that it all could have been prevented had I been properly educated on the subject does really upset me. Suicide is a very real problem and it needs to be brought to attention and addressed. To conclude my argument that schools need to require classes focused explicitly on mental health, I ask that you do your part in destigmatizing mental illness and any struggles with mental health that people encounter, normalizing the fact that everyone will struggle with their own mental health at some point in their life and that it's okay, in fact encouraged, to get help and express those feelings will only lead our society to more progress. You can also look into the Jason Foundation, which is an amazing website filled with important information on mental health and suicide prevention, started by a father who lost his own son to suicide and is looking to increase awareness on the subject. Thank you for listening.